Hi, Dr. Peters. It's so wonderful to have you on the podcast today. Welcome back.
Thanks for having me. It's always a pleasure.
Of course, we're so happy to. And we're really happy that you're one of the first to pioneer the patient perspective podcasts. So I'm wondering, how do you recommend physicians to motivate patients to use CGMs or continuous glucose monitoring?
First off, I think patients like tools that could help them. And one of the ways in which I motivate patients to use CGM is just to tell them how I think it could help them. And I'm pretty sold on CGM. I love having the data to help patients. And one of the things that most patients worry about is, what does it feel like to wear something on their body? Because many of these patients haven't done it. So in the office, I just have, samples or old sensors or whatever that I can just show them or put on them to help them understand that it isn't some big obtrusive process, but it's something simple that can provide helpful information.
Okay, well, that makes sense. And in general, how many patients agree to use CGMs, or do they hesitate to do so usually?
Well, again, it depends on if the patient thinks they're having a problem. If you think you're fine, you're not going to want to wear something on your body that gives data. But if you want to improve and there's a tool and your doctor or educator suggests it, many people are open to the idea. But one of the big barriers is cost. And so some people's insurance pays for it better than others. And sometimes there are requirements like people need to be on multiple daily insulin injections or whatever. And if I'm trying to use it in somebody who's not on multiple daily insulin injections, it varies in terms of cost. So it's a balance between benefit and cost and what a patient thinks it's worth to them.
Okay, yeah, I can definitely see how that would discourage a patient. So how do you think we can increase the use of CGMs among the undeserved population?
There are a couple ways. One is that you can use what's called professional CGM, which is blinded. And I don't really like that because the patient can't see in real time what's happening. But it at least gives me, as a clinician, a sense of what's happening with the patient's blood sugars. And that can often be a way to get people into the more real-time CGM that they can use to look at their data, because I can often use it to prove to an insurance company that there's validity in the device. But the other thing is that we also have programs where I do research and get devices donated so that I can use it in patients. And again, as soon as they're convinced of benefit, then some of them are willing to pay for it, even if insurance won't. But again, it's about what a person can afford and how it works for them.
Okay, thank you. Would you like to add a message for clinicians regarding patient perspective for using CGMs or any other clinical pearls today?
I think the most important thing for clinicians is that the clinicians have to understand the data so they can use it in a patient visit. So data that's provided that isn't acted on becomes relatively useless. And so I actually engage the patients with the data and show them how they can look at it and how they can interpret it. And in some cases, you can set up the smartphone or the receiver to actually show them aggregate data and look at their progress. And so I think that the physician's enthusiasm at looking at the data goes a long way in encouraging the patient to use it. So I still can't get everybody that I think should be on a CGM, but many people do want to do it because they feel that it's a process that I'm engaged in with them. It's not me against them, or it's not me showing them that they're wrong or doing something bad. It's a process together of helping the person with their diabetes. So I look at it that way. I love the data and I love sharing it with patients and I love helping problem solve. So it works.
Absolutely. And a patient can look right on their smartphone, which is absolutely helpful for them as well. So that's wonderful too. Thank you so much, Dr. Peters. It's really been very insightful and a pleasure as always.
Thank you.